As you know and as you heard, West Cecil Health Center is mission driven, and so is our School of Dentistry. These are two organizations who really get it. They get why providing high quality, compassionate care to people is so important, is the right thing to do. But it's not just about providing exceptional care. It's about providing the care regardless of a patient's ability to pay. In this unique partnership, there are lessons for all of us, lessons about how we innovate practice, healthcare practice, to serve the most people. And importantly, and I'm looking at many of the providers here, to serve them regardless of their ability to pay with dignity. Lessons about doing whatever it takes to get a deal done when you know that the deal is a good one for the people of these counties. That's how you take care of Maryland's communities. That's how you take care of the people of our state, all of its people. I often say that I'm proud that my university, the University of Maryland, Baltimore, has the city of Baltimore in its name, and I am proud. But we take very seriously our profound responsibility to Harford County, to Cecil County, in fact, the entire state. We embrace it, we live it, and with this partnership, we're putting our Maryland mission to work.
It is a great pleasure to be here today to celebrate the launch of this innovative, sustainable model of, for high-quality oral health care delivery. We believe that this is first in kind nationally. We're very proud to be part of this partnership, which provides an opportunity for us to begin to reduce barriers to access to care and to provide care to the citizens of Maryland, including those that traditionally have been blocked from care. This model for us provides an opportunity as well educationally. We believe strongly that the opportunity for our students to be part of multidisciplinary care will better prepare them to enter a workforce where integration into the healthcare network is absolutely critical. And I'm, too, very grateful to so many here today that were instrumental in helping us forge this relationship, this collaboration. In particular, John Ness, West Cecil Health Center and the board, Dr. Richard Zummel at Union Hospital, Mark Luckner at Maryland Community Health Resources Center, as well as our elected officials. Delegate Kevin Hornberger was instrumental. I'd like to give a shout out also to Dr. King Smith, one of our faculty. He shared the vision. He helped excite others to understand what we could accomplish. And so thank you, King, for that. I'd like to thank Dr. Jay Perman, President of the University of Maryland, Baltimore, for his support and for his commitment to this novel, innovative partnership that will allow us to, I think, bring care forward over the years. I'd like to also acknowledge that we have some students and faculty as well, and our president of our alumni board, Adam Eisner, so thank you, Adam, for being here. We feel strongly in this joint venture that the needs of the community will be met. The needs of the community will remain our first priority, and as partners we have leveraged our strengths and resources to ensure that those needs will be met for years to come. The School of Dentistry, I know, our faculty, staff, and students are proud and honored that we have an opportunity to work together in Harford and Cecil counties through the clinic here to provide care to the residents that are so deserving of attention.
Few people understood the importance of good health or good dental health and what impact a lack of access to proper dental care could have until the tragic death due to an abscessed tooth in a 12-year-old boy when this event brought it to the forefront in our state. Unfortunately, it took a tragedy like that to provide the impetus for this amazing facility behind me. With the support of my predecessor at Union Hospital, Dr. Kenneth Lewis, the University of Maryland Dental School brought its expertise here to provide comprehensive dental care to the most neediest in our community. However, despite the tremendous success of this program over the last 8 years, keeping the doors of this wonderful facility open was much more difficult than you could ever imagine. So a few words of thanks. First, to Delegate Kevin Hornberger in particular, and to Senator Steve Hershey for their persistence in ensuring this facility would remain in service to our community. Second, to the incredibly dedicated University of Maryland dental staff here on site here in Perryville, led by Dr. King Smith, whose enthusiasm for their work and the love of our community and the patients they've served was infectious through this entire process, even in the darkest moments, and we thank you for that. Third, to Dr. Dean Reynolds for his commitment to allow University of Maryland dental students and fellows to continue to serve at this site, benefiting not only our community, but as we were talking earlier, I think also the students and fellows. And lastly, a very special thanks to John Ness, to his staff, and to the board of directors of West Cecil Health for having the courage to take the responsibility for providing this much needed service for our friends and neighbors in Cecil County, especially those lacking the financial means to receive proper dental care on their own. John, please know that Union Hospital stands with you and will be there to support you all through this process.
This is a classic example of as Dr. Chan said, a public-private partnership that uses our seed funding, a small investment, to help be a multiplier effect to get additional investment from Union Hospital. So I haven't had a chance to meet you yet. So thank you for having the foresight and the commitment to use a portion of your community benefit resources to help make an additional financial investment in this program. And I'm so delighted to hear that you're going to have West Cecil's back here as the program's implemented. I also want to take a minute on the notion of replicability. This is the second program that we've been able to support with Dean Reynolds and President Perman. You may recall about a year and a half ago, we were both on the speaking bureau here in Frederick when we were also speaking at the Frederick Monocacy Boulevard event. So we're so thrilled that once again the dental school has stepped forward to partner your resources and to partner with another ambulatory care provider here to expand resources here in the underserved area of the state. You touched on the tragedy that occurred in Prince George's County, which was also the same year that the governor signed the bill into the law creating our commission. And so expanding access to dental care has been, if you will, in our very DNA. And so of the 190 grants that we've awarded, 36, over 7 million, have served over 50,000 low-income adults and children to provide access to dental services.
You know, this was, again, successful on the part of many, many different organizations and folks that helped put this together. Thank you so much for making it a success, and thank you all for being here today.
5, 4, 3, 2, 1.